Hello everyone. Welcome to today's presentation. We're going to explore an exciting topic from your student's book, pages 190 to 191. The focus is on Mega Goal 2.2, Unit 12, and the fascinating subject of DNA. The title of today's session is What Would You Do? Reading. We'll be looking at some interesting questions and scenarios related to DNA and how it influences our decisions. So, stay with me as we dive into this intriguing subject. Let's get started. Let's start with a quick warm-up. Looking at the pictures on this slide, what do you see? Take a moment to observe each one carefully. Do any of them stand out to you? Now, based on what you see, what do you think our lesson will be about today? This activity is designed to activate your prior knowledge and get you thinking about the topic in a fun and engaging way. As we go through the presentation, keep these images in mind because they relate to the key ideas we'll explore together. The goal here is to connect what you already know with new information, making the learning process more meaningful and memorable. Welcome to this slide titled Peeking into Our Medical Future. As we look ahead, it's fascinating to consider how rapidly technology is transforming healthcare. The numbers you see here, 6, 5, 4, 3, 2, 1, are a countdown, symbolizing the exciting milestones we anticipate in the near future. Each step brings us closer to innovative solutions that could dramatically improve patient outcomes. For example, advancements in personalized medicine are enabling treatments tailored specifically to an individual's genetic makeup. This means more effective therapies with fewer side effects. Another key point is the rise of AI and machine learning. These technologies are already starting to assist doctors in diagnosing diseases faster and more accurately. Imagine a future where AI-powered tools can predict health issues before symptoms even appear. We're also seeing incredible progress in wearable devices and remote monitoring. These tools allow for continuous health tracking outside clinical settings, giving patients more control over their health and enabling earlier interventions. All of these developments connect to our overall theme of a future where healthcare becomes more proactive, precise, and patient-centered. The goal is to make medical care more efficient, accessible, and personalized, ultimately leading to better health for everyone. Now, let's take a closer look at some potential diseases that genetic testing can help identify. On this list, we have physical problems, mental problems, cancer, and Alzheimer's disease. What's really interesting here is that genetic testing can be a powerful tool for detecting certain conditions early on. For example, some physical problems and certain types of cancer have genetic markers that can be identified through testing. Similarly, genetic factors can also indicate a higher risk for mental health issues or Alzheimer's. By understanding these genetic predispositions, we can work towards earlier interventions and personalized treatment plans. This ties into our overall theme of how genetic testing is transforming healthcare, making it more proactive and tailored to each individual. So let's take a closer look at what's inside each cell. What does each cell contain that makes it so special? Well, it holds genetic material, which is essentially the instructions that determine how we look and function. Now, you might be wondering, what exactly is genetic testing? It's a process used to analyze these instructions to understand more about our genes. And speaking of genes, here's a little challenge. Find a word that means related to the part of a cell that contains your parent's characteristics. Think about it for a moment. That word is genes. Genes are the specific parts of the cell that carry all that important information from our parents, shaping who we are. This ties into the overall theme of our presentation, understanding our DNA and how it influences us. Recognizing what each cell contains and how genetic testing works helps us better appreciate our biological makeup and the role genetics play in our lives. Let's take a moment to think about some key words related to problem solving. First, find a word that means the identification of the cause of a problem. This is about understanding what's really behind an issue, so we can address it properly. Recognizing the root cause is crucial because it helps us develop effective solutions rather than just treating symptoms. Next, find a word that means capable of being cured. This highlights the importance of knowing whether a problem can be fixed or not. When a condition or issue is curable, it opens up opportunities for intervention and improvement. Connecting these ideas to the overall theme, understanding the cause of a problem and knowing if it's curable are fundamental steps in effective problem management. They guide us in making informed decisions and taking appropriate actions. So, mastering these concepts helps us become better at resolving issues and driving positive change. Let's look at this slide and think about the words that mean certain ideas. First, find a word that means experience. You might think of words like knowledge, familiarity, or practice. These all relate to something you've gone through or learned over time. Experience is about what we have lived or encountered, and it shapes how we see and understand things. Next, find a word that means received from a parent or ancestor. This could be heritage, legacy, or tradition. These words refer to the values, stories, or knowledge passed down from those who came before us. It highlights how our background and family history influence who we are today. Connecting these ideas to the overall theme, understanding these words helps us appreciate how our experiences and inherited knowledge shape our identity. It reminds us that we're part of a larger story, built from what we've learned and what we've received from those who came before us. Let's start by considering the benefit of a positive test. When a test comes back positive, it clearly indicates the presence of the condition or issue we're investigating. This helps us take immediate action, whether that's starting treatment, making adjustments, or further assessing the situation. Essentially, a positive result confirms that something needs our attention, which is a crucial step in managing and addressing the problem effectively. Now, moving on to the benefit of a negative test. When the test is negative, it provides reassurance that the condition is not present at that moment. This can prevent unnecessary worry or interventions, saving time and resources. It also helps us rule out possibilities, allowing us to focus on other potential causes or areas to investigate, which is vital for accurate diagnosis and decision-making. Next, let's find a word that means done in order to avoid. A good word for this is preventive. Prevention is all about taking actions beforehand to stop something unwanted from happening. It's a key concept because it emphasizes proactive measures rather than reactive ones. By understanding the benefits of both positive and negative tests, we can better strategize preventive actions to improve outcomes and avoid potential issues altogether. So let's take a moment to look at the example given for an untreatable disease. Can anyone recall what it was? That's right, Alzheimer's disease. It's a heartbreaking condition, and currently we don't have a cure for it, which makes it a prime example of an untreatable disease. Now, moving on to the next part of the slide, I want you to find a word that means causing disagreement. Think about words that describe situations or topics that people often argue over. This is important because understanding how disagreements arise can help us better navigate complex issues, especially in healthcare and science. When we talk about diseases or treatments, disagreements might stem from differing opinions on research, ethics, or resource allocation. So, as we continue, keep in mind how these disagreements can impact decision-making and the development of new solutions. This ties back into the overall theme of how we approach challenging problems in medicine and society. Find a word that means the possibility of being or doing something. This is a really important concept because it connects to how we see opportunities and potential in our lives and work. When we talk about the possibility of being or doing something, we're essentially referring to the chance or potential that exists for a certain outcome. It's about recognizing that there are options available, even if they're not guaranteed or certain. Understanding this idea helps us stay open-minded and optimistic, especially when facing challenges or exploring new ideas. It also ties into the overall theme of growth and potential, realizing that there is always room for what could be if we take the right steps. So, in our journey, knowing about possibility encourages us to believe in what's achievable, even before it happens. Now let's look at how we approach answering true or false items. First, it's important to carefully evaluate each statement before choosing an answer. As you can see here, the responses vary, with some being false, others true. It's crucial to understand the reasoning behind each answer, rather than just guessing. For example, when you see a statement marked false, ask yourself what clues or facts support that choice. Conversely, when it's true, make sure it aligns with what we've discussed earlier. Remember, accuracy in these responses reflects your understanding of the material and helps reinforce your overall learning. So, always take your time to analyze each item thoroughly, connecting it back to the key concepts we've covered in this presentation. Yes, because genetic testing can really help people prepare for possible future health issues. It gives them the chance to take preventive measures before problems become serious. However, it's important to remember that some people may experience anxiety or stress from the results, especially if there's no clear treatment available. These tests are useful because they can detect potential health risks early on, which allows for better planning and proactive care. But it's also true that the results can sometimes be difficult to interpret, or they might lead to tough decisions about health and lifestyle. When it comes to carrier screening, it's especially valuable for parents. It helps them find out if they carry genetic conditions that could be passed on to their children, giving them important information for family planning. Moving to ancestry DNA testing, I think it's a fascinating way to learn about our family origins and cultural heritage. Many find it enriching and connecting. But of course, there are privacy concerns, since sharing genetic information with companies can raise issues about data security and misuse. That's why, when we consider these tests, it's essential to weigh the benefits of making informed health decisions against potential privacy risks. And with ancestry testing, it's important to ensure strong privacy protections are in place so that genetic data isn't misused. Overall, genetic testing offers incredible opportunities for health and self-understanding, but it's crucial to approach it thoughtfully, keeping privacy and emotional well-being in mind.